Hello everyone, this is Dr. Shawn Pourgol. I'm president of National University of Medical Sciences in United States, which is the first and only school of manual osteopathy in the United States of America. In the US, there are two types of osteopathy. One is called American style osteopathy or osteopathic medicine. They are basically the osteopathic physicians, similar to medical doctors. They provide surgery, medications, and all other types of medical care. Then there is manual osteopathy or European style osteopathy, and for us to distinguish ourselves from them, we call the profession osteopathic manual practice there. Forgive all these flies here. When I do videos in Naples, Florida, because I do it in the nature, always mosquitoes are in my videos. And in Spain, now I am in Spain, we have a university in Madrid, National University of Medical Sciences, Spain, and flies in the countryside. But I prefer flies to mosquitoes. Mosquitoes bite you and sting you, and every time I get home, I have all the insect bites there. So we offer two different type of, first of all, I created NUMSSUSA in 2016 because my goal in life is to ensure every town with a population of 100,000 people at least has one manual osteopath in it. Manual osteopathy does wonders in treating chronic pain. Most of the patients we see are last resort cases, and as such I want everybody in the world have access to this wonderful, miraculous healthcare. So I opened NUMSSUSA in 2016, March 2016, and we are now the only school of osteopathic manual practice there. We offer two different degrees. One is a Bachelor of Science in Osteopathic Manual Practice. Another is a PhD in Osteopathic Clinical Sciences. In our University in Madrid, we offer a Bachelor of Science in Osteopathy and a Doctor of Osteopathy, DO, but in US, DO are osteopathic physicians, so we changed it, the program, we made it a PhD program, so people not to get confused with DO in manual osteopathy and DO in osteopathic medicine. Now, these two programs, they share a lot of courses. All osteopathic techniques we teach, both of them have it. So technique-wise, they learn the same amount of technique. Most of the basic clinical sciences are also the same. The difference are in some courses like ergonomics, pediatrics, conditions of the foot that we go a lot in more detail. Then osteopathic accelerated treatments like decompression, traction therapy, physiotherapy modalities, and so on that the PhD program has, but the BSc program does not have. Also, the PhD program has my business lectures. I give over 250 business lectures. I teach my students everything I know about business management so they can run their clinics effectively. And these business lectures are the reason my students make gross income of $150,000 per year, which is $60,000 more than other manual osteopaths. I teach them a wide array of subjects on asset protection, tax planning, marketing, advertising, public relations, accounting, investment, and so on. And these business lectures separate us from others. These are the reason we graduate wealthy manual osteopaths. The PhD program is our most popular program for NUMSSUSA. But it requires a bachelor's degree. So a lot of people, like massage therapists who want to take this program, they have to take it as a dual degree, the Bachelor of Science - PhD, because Bachelor of Science is a requirement. You have to have a bachelor's degree to get the PhD program. So a lot of people take the Bachelor of Science degree with the PhD together, and they can graduate with 2 degrees at the same time. My recommendation is for people to take the PhD program. The Bachelor of Science is good for people who don't have the budget at this moment to study the PhD program. It's less tuition, and they can take it and later on take the PhD program. But the PhD program, or its equivalent DO at the NUMSS Spain in Madrid, that is the ultimate program in manual osteopathy that we offer and or anyone else offers. So in summary, the osteopathy techniques are the same. The basic clinical sciences are the same. And what differs is some courses like ergonomic and pedortics, auxiliary therapies that the PhD has, but the Bachelor of Science doesn't have. And but the main important one is my business lectures. If you end up just taking the Bachelor of Science, I recommend you take it as a dual degree with the Master of Business Administration, MBA in Healthcare that we provide. It has all my business lectures. Those business lectures are what really sets you apart from others. These flies are really like active. My God, they don't give up. They don't give up. They have perseverance. That is good. That is good. But with both degrees, the Bachelor of Science and the PhD, our alumni can join and work for Osteopathic Chronic Pain Clinics of Canada. This clinic I founded in 2017, September 2017, and from one clinic in Toronto, we now have 346 clinics in 33 countries, including many states in the United States, such as Washington, Texas, California, New York, Idaho, and others. We only hire graduates of my schools for this clinic, and this clinic is rapid growth, exponential growth is the result of the effectiveness of our graduates in treating chronic pain. Especially now they are busier after the COVID-19. The incidence of chronic pain has risen a lot, and because people being cooped inside and they're not as active as before and they're eating more, and this has increased the incidence of chronic pain, and many of our clinics are busier. I have a student who studied the Doctor of Osteopathy at National University of Medical Sciences, Ali Hariri, Dr. Ali Hariri. He practices in Ontario, Canada. He's one of my rare students who has $1 million clinic. He has 16 health professionals working for him, and 3 months ago I saw him in Toronto, and he told me that he hired 3 of my students at National Academy of Osteopathy in Canada because he has so many patients wanting to receive manual osteopathic care after the COVID-19 because now there is a lot more incidence of chronic pain. As long as there is chronic pain, there is always a need for manual osteopathy. As I said, we treat last resort cases other health professionals cannot help, and they come to us. A lot of our alumni have fully booked practices, while other health professionals usually take 5 years to have a fully booked practices. Our alumni, usually some of them in months, they get fully booked practices. That's the power of manual osteopathy. That's how good the profession is in treating chronic pain. Okay, that's it for today. These flies don't want me to speak too much. I'm grateful to God for allowing me to see this beautiful Spain one more time. As I always say, God has created a beautiful world for us. We just have to open our eyes and appreciate all this beauty. I pray for you wherever you are to have a wonderful day filled with love, health, happiness, and wealth. Take care of yourself. God bless. Namaste.